Everyday Period removes the stigma, the strangeness, and the awkwardness from reproductive health and introduces real empowering conversations to gain greater understanding. Hi, I'm Shelly-Ann, your host and guide as we navigate the murky waters of all things reproductive health. Are you ready? Okay, so we are very, very excited. I said we, come in also you excited to introduce our new guest to the set today, Miss Gianna Fakhourie, the big, big boss and creative genius behind the original Arm Candy brand. And we want to find out a little bit about her business because that's what we do here on Everyday Period. Hi, Gianna.
Hi, Shelly.
Welcome to Everyday Period.
Thank you so much.
Well, let us jump right into it. Every single guest on Everyday Period has to answer one question. Do you remember your first period?
Yes. Well, yes.
You want to tell us about it?
So my first period, I had like a pre-period period.
Oh, I want to hear about this. Mm-hmm.
So I think I was like 9 or 10. Hold on. When was common entrance? I think I would have been 10. 10. And I had like this. The only way I can describe it now is now that I know what losing your mucus plug looks like from pregnancy.
Yes.
That's what it would have been like. It was like this little mucusy.
Oh, so it's like a little clear. It wasn't actually blood.
Yeah, no. It was like trace blood. But it came out.
Yes.
And I was like, oh my God. I was at boarding school. I went to Knox. So, of course, I didn't know who to talk to about what, because, you know, you have house mothers, but you're like 10. Like, what do you say? And I had a mother who was she was not the typical mother, right? So, the only information I got on periods by then was, you know, boarding school gives you a list of things that you need to bring.
Okay.
And on the list is sanitary napkins.
Okay.
So, of course, I'm reading off all the list for everything to be packed for me. This is when I was like 8 years old, like 9 years old, right? So I'm reading off the list and I get to sanitary napkins and I ask her and she's like, oh, when I get home, I'll tell you. Oh, tomorrow I'll tell you. Oh, like, so every time I ask, it's like, what is this? What is a sanitary napkin? Instead of my mother just saying, it's a pad, you're going to end up with your period, you're going to bleed, blah, blah, blah. You
didn't get any of that?
No, it was like, the egg drops. And that's what you use a sanitary napkin for. Like, it was literally like, I had no idea. I was more confused than anything.
What egg?
I don't know. Up to now, I don't know. I don't understand the explanation. So, how I ended up knowing what a period was is obviously I'm at boarding school now for 2 years at that point, and you know I was in an all-girls hostel that had different dorms. So the older girls are in the dorm next door. Okay. So you know when they're having their period, you know they talk about their period. You go in the shower and you hear about the period. So I knew what a period was, but then I didn't know how a period starts. So then I see this mucus thing and whatever, and I'm like, oh my God, I got my period. Except I didn't get my period. That's what I'm saying. It's a pre-period period.
Oh, so it wasn't actually a real period.
No, and it never came for like another 6 months or so when I was in the 7th grade. So I would have been probably like 11 when it really came. And that time I was freaking out because I was very popular, even though I was young and 11 and whatever. It's a co-ed school. Knox is a co-ed school, but we're in the girls' hostel, right? But you go to school every day with the boys, and the boys were my friend. I was very popular and whatever. And like all of a sudden, I'm like, they know. There's no way they're not gonna know. They know.
So you were having a proper meltdown.
I went to my teacher. I think she was the teacher for religious studies. And I was like, everybody knows I have my period. And And she's like, nobody knows. What are you talking about? I'm like, yeah, how do they not know? I know. I can feel it. I can see it. I can smell it. It's just it. No. And she's like, they don't know. I'm like, they know. Everybody knows. So I just hated that whole everything.
The whole experience. Wow.
Right.
Well, and I can understand how that can be very scary, because without any information at all in that kind of environment, it makes a lot of sense. And that's the reason why we really, really stress that we have to have the conversation. You have to prepare girls for this experience, because it's coming and we don't know when it's coming. So it's better if they have what they need and they have the information. But I really need to find out more about that thing where you say, everybody know. What made you think that everybody just know what was going on with you?
Because I think I was so conscious of it, and I could feel it.
It was obvious.
It was, yeah, for me, it was like, oh my God, they know. Everybody knows. Then you have to change for PE and all these things. And I'm like, oh no. And I don't want anybody knowing.
Okay. Wow. Well, with that kind of story, we're all going to need a break. I know certainly I do, and I'm sure Gianna does too, because she's reliving the moments and the trauma. So don't go anywhere. Everyday Period is going to be back with more stories from Gianna, because we don't hear what going with her. No! Don't move. The information shared on Everyday Period is for educational and informational purposes only, and is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of a qualified healthcare provider with any questions or concerns you may have regarding your health or medical condition. Never disregard professional medical advice or delay seeking it because of something you heard on this show. Your health is unique, and only a medical professional can provide personalized guidance. Welcome back to Everyday Period. We're here with our very vivacious guest, Miss Gianna Fakhourie. And I told you that I'm going to get into our business. So if we get into our business. So after you've had this very exciting start to your period journey, what have you learned? If you were to compare where you were then and where you are now, big woman, you've had a baby, you have gone through different stages of life. How would you say your journey has been affected or impacted while you go along with your period? Because like for me, my period started off very long, very painful, very uncomfortable. And as I grow and I learn more, I figure out how to have pain-free periods. And I've been able to do that. And so I'm just trying to figure out for you, what has your period journey been?
My period journey started out after all the drama. Mm-hmm. It was pretty uneventful for maybe a few years until I was a teen. Mm-hmm. And then once I was a teen, it was pretty painful, but it wasn't a debilitating pain. It was like, mild cramps, I think. Yeah. Mm-hmm. And, you learned, back then you have Self magazine and you have this and you have that. Mm-hmm. So you learn the different yoga poses you can contort yourself into to try to ease it.
Yes.
And so it was pretty much okay. So when I was 20 years old, I went to the gynecologist for the first time. Mm-hmm. And this gynecologist, he actually delivered me as a baby. So
in the beginning.
Yeah. So I went to him and I said, listen, I had read that you were like 9 times more likely to have endometriosis if your mother had endometriosis. Okay. Mm-hmm. And my mother had endometriosis. Mm-hmm. And obviously this was her gynecologist. That's how come he delivered me. Mm-hmm. So I went to him and I was like, listen, I'm having an okay experience so far. Is it a case where I'm going to have endometriosis? And he was like, no, you'd probably show the signs by now. You should be okay.
Okay.
And I was like, oh, okay. That sounds good. Mm-hmm, mm-hmm. And then by the time I was 22, I started having debilitating periods, but they weren't consistent.
Okay.
They were not every month debilitating. It was just here and there.
Right.
And I was like, but why is this happening? And I went back to him and I was like, is there something else going on? Like, because you said I shouldn't be having, and he was like, no, like different things happen in your body. And, based on how dehydrated you are and stuff like that, like different things will cause more cramping or less cramping. Like I wouldn't worry too much about it, whatever. By the time I was 25, I was throwing up.
Oh, so it got progressively worse.
Yes, it did. Mm-hmm. And then it was just like, I don't know what to do now. He sadly was sick by then, so I was no longer going to him, and I had moved back to Jamaica at the time. And everywhere I went, they were like, well, it's sounding like endometriosis, but we can't confirm that except by like actually looking.
Right.
So, and I have a blood condition. I have antiphospholipid syndrome. That's your blood clots extraordinarily.
Oh, so it's very easy to clot.
Right. So as a result, they don't like to do surgery or anything like that. And since surgery is what would make you actually
diagnose endometriosis.
Right. So then we said, okay, we're not doing that, but they would treat me for the pain, the symptoms, right?
Right.
So that's been going on. And there have been times, Shelly, that I have prayed to God for death.
Oh.
When I'm on my period.
Them kind of pain there.
Yeah.
Yes, man.
So for me, when you ask the experience and the journey and everything, it's been terrible.
I want to talk a little bit about the pain. Hold on. I know we have more to talk about, but what you just said a while ago, hit a mark with me. Because believe it or not, you have some people who hear women say that their periods are painful and they don't feel pain every month. And they cannot believe that it's as bad as we say it is, because we must be exaggerating. Like, it cannot be that bad. I actually heard somebody say that. It cannot be that bad. And I try my best to try, especially for men, to try to get them to understand that this is not discomfort, inconvenience level pain. This is, you'd rather die than feel this level of pain. Yeah. And I think it's important for people to get that, because I've seen, even in workplaces, you can call into work, and if your asthma act up, sympathy. If your big toe that you did day and the bruise up, act up again, and you can't wear close-up shoes, wear your slippers, no problem, we understand. But period, nobody wants to hear about you and your period pain. You get period from your child till now, you're supposed to used to it, take 2 pills and come to work.
Right. And there's no getting used to the pain.
How do you get used to pain?
No, you cannot get used to it. I have had pulmonary embolism, which is blood clots in your lung.
Right.
And I had 3 at one time. And I walked around with them for 3 days, which is very painful in your chest.
Of course.
Extremely painful. I didn't know what it was. I thought it was gas. I blame
Jamaican business.
I blame my Jamaican roots because I thought it was gas.
Yes, ma'am.
If you ever heard me I was calling my aunt down here like, what else can I take for this gas? This gas is terrible.
And you drink the tea already and it never works.
Yes. And I take the purple pill like you tell me. I take everything. What's going on? Right. So I had that for 3 days. And during the 3 days, as bad as it was, and it was bad, I never prayed for death. So I need you to understand that if I'm having my period and I'm praying for death, that it's that bad.
It's serious.
And, more recently, so I had appendicitis. I ended up in emergency surgery on April 16th, 2025. Just the other day, yes. My period came the night before.
Oh, so you thought that was period pain?
So I need you to understand that I had the appendicitis for 4 days before actually going to get any sort of help. So no, I took 2 days before I actually sought help. And then it was 4 days until the emergency surgery.
Right.
And the people at the hospital told me that they are scared of me. They said they don't know, they can't listen to me when it comes to rating pain.
Yes.
Because they are certain what the pain was. And I was giving it a 4. They said a normal person would have given it a 12. They said a 12. Yes. So this is the conditioning that my period has given me. And again, I didn't wish for death. This is what I'm saying.
Yeah.
So I feel like it's so dangerous what we actually go through. I don't know how many people go through what I go through, but I feel like it's so dangerous because appendicitis is life-threatening. It's not something that you wait 4 days to address. You don't wait 2 days to address it. Actually, I did a quick Google search during all of the hullabaloo, And it's like within 2 to 4 hours is when you're supposed to get help.
It's emergency. It's considered if you're rushed to surgery for appendicitis, it's an emergency. For sure.
So I was able to go 2 of the 4 days with no pain, anything, no painkiller,
no kind of pain management,
no nothing.
Mm-hmm.
And that in and of itself is so dangerous too, because like by the time I got to the doctor did my blood pressure and it was 161 over 131.
Which is crazy.
Right. So he said on that alone, he could hospitalize me. Like, it's insane. And he said it's the pain that would be causing that. And I'm over here saying, it's pretty sad that I go through this pain every month, sometimes even expected to go to work. Like I would imagine all the time expected to go to work, but because of how I am,
Mm-hmm.
like if I know that I am praying for death, I'm not going in. So I'll take whatever vacation day, sick day, whatever they force me to take as a result, I'll do that. But the expectation is that I should work through it.
That's such an important point. Let's pause here. That's such an important point because it's not enough that you're in debilitating pain. You're also expected to function while your body has fight against you.
Yes.
And that's just what we expect of women generally.
Yes.
And people will say things like, so then like what's the big deal? You have a period every month. So what? And I really want us to get to the point where we start to recognize how important support is and how important rest is when it comes to our menstrual cycle, especially for those amongst us that have very difficult, debilitating periods. And a lot of the times we spend a whole period of time in limbo because we don't know exactly what's causing these severe symptoms. We understand that having this level of pain is an indication that something else is wrong, but it's not obvious. It's not, you just go to the doctor and tell him, say we have painful periods, and they go, oh, this is what it is. Here's the cure. Be on your way. If we talk to survivors of endometriosis, sometimes it's 7 to 10 years before they're actually diagnosed for them to actually start getting the help that they need, right? So I really think it is important for us to just exercise some grace here, exercise some empathy here. And I really want employers to listen to this and to heed it when you are trying to help your team member who's saying to you, I have this difficulty with my period. I just wanted to make that point.
Yeah, because I've actually gone in on some days because something is pressing or whatever the case is. And I've gone in and the people in the office look at me and they're like, what's wrong with you? Because normally I don't go in. Mm-hmm. So when they see me, I'm always chirpy and nice looking. And then when I go in and I'm on my period, it's like, what's wrong with you? Because I'm pale. I'm like clearly fighting something and I'm slower. I know I'm slower. So even when I used to work on TV, God bless my producer, Keish, big up.
Keish.
I used to tell her, like, please don't schedule me around this time. And I wouldn't have to go in because even my brain works slower when I'm on my period. I don't know about other people. And I know people don't want to see themselves as slower or less than or anything like that. But I know I am. On my period, I am less than.
Well, for me, it's not so much my period, but in my luteal phase, I physically feel slower. Okay. So it's not just the thought process. It's everything that I do takes more effort.
Yeah.
Like sometimes, because I walk every day and I exercise and stuff like that. So even when I'm exercising, I'm walking slower. It's taking a lot more energy for me to do some simple tasks. Like everything is just on go slow for me. And even in that week, I'm like, most things I just can't bother. If you listen, anytime you ask me anything, I'm just saying I can't bother. Luteal phase. I can't bother. I call it the can't bother phase. So I get that. And even with the thought process, some of the times it's not so much that it's moving slow, It's just that my memory, I can't remember some stuff. Because I write everything down. So a lot of times I have to go back to the notes and remind myself about something that I would really be very quick with. So it's like my memory needs more work. I just have to do more, and it takes a lot more effort to do a lot of things during that phase. Yeah. So I get that.
Yeah. So that would happen to me. And like, if you're a talk show host, you kind of need to
You're
be...
not so quick. And if y'all ever seen her on TV, you'll know she's quick.
Because I'm not on my period when I'm on TV.
Yeah.
So those things would happen. So you can visibly see. And who wants to go out and have people see them when they're not at their best either? So that would be my way of just, kind of controlling what I can. Right? Because of course I can't control the pain. Big up to my gynecologist, who is Sarah Grace Lawrence Lewis. Hi. So she is really supportive when it comes to my pain management, because like she will ask me before I even ask her, and she's like, listen, there's no prizes for going through pain. There's no prizes for going through pain.
Say that to the camera.
There are no prizes for going through pain.
You know yourself, you right there. Say it again, Gianna. She never hear.
And I'm quoting Dr. Sarah Grace Lawrence Lewis. There are no prizes for going through pain.
Yes.
So she is always saying, okay, like, do we need to adjust like the mix? What do we need to do? Like, I've even been able to come off of something based on how she not just diagnoses, but how she prescribes other things. So it's actually worked for me. And let me tell you, like, because mine is so bad, I've even gone to like a pharmacy. I won't even say the name of the pharmacy, where the lady looked at me almost like I was a drug addict, like asking,
you tried to score.
Yeah, like, do you really need that? I don't know. Did you take this already? It says something here. I'm gonna have to call the doctor. And I'm over here like, oh my God.
Yeah.
Like, I literally only take this during my period. Like, I don't even take it otherwise. And I'm sitting there, and she called, and it was like, it was late. It was like right before the pharmacy closed. And I'm there saying, I wonder if she's even going to get through to Dr. Lawrence Lewis. I'm like sitting there saying, is she actually going to get her? And then, oh my gosh. And apparently, she did. And like, she increased, like, cause they can call in or whatever. And she increased, like, double the thing, saying, give her, like, and I was like, so grateful. Cause I was like, you feel like, okay.
You feel supported.
Yes. You feel beyond supported at that moment, because remember, now this person is questioning your character, your integrity, like your everything. And I'm over here just trying to get something for my
the pain. Yes. You know what? And on that note, we're going to take a break. But we just want to say a big ups to the doctors that get it. The doctors who really listen to their patients and try to help them in a unique way, because we know one size certainly does not fit all. And what works for one patient may not be as effective in another patient. So thank you to the doctors who are really listening to their patients and doing what they can to help support us, because that makes every difference. We'll be right back. Let's normalize the talk, celebrate the experience, and make periods something we're proud to discuss. Welcome to the conversation. I want to hear from you. If you have any questions or comments about the topic, or if you have a question about reproductive health generally, send us an email at embraceherflow@gmail.com. You can also like, share, and subscribe to our channel, Period TV. And just remember, we are here for you. Everyday Period is brought to you by Her Flow Foundation, empowering Jamaicans one flow at a time. Boy, welcome back. We're having a very, very spirited conversation with our wonderful guest here. And she's my friend, and I'm a good nice friend. We've been through some things. Gianna Fakhourie. And I just want to find out from you. You've been through all of this, different stages of periods. The periods have definitely changed over the years. What have you learned? What are some of the things that you realize has worked for you over the years? And you want to share some tips that somebody who's watching can learn from and use?
So I haven't mastered anything. Please understand that. Just the other day, I was in the hospital over this whole thing.
Yeah, man, we get that.
But I would say advocating for yourself is very important, and from early. And I'm going to tell you why I'm saying this. And I've only learned, and I've not done it, right? So this is just what I've learned. Because when the doctor, big up Dr. O.G. Thomas, he was a surgeon. When he took out my appendix, he said that he sent it to histology to get tested. But his belief is that I've been having chronic appendicitis because he believes, he's going to find out, but he believes that endometriosis is inside the appendix.
Yes.
So basically, that would mean that the period pain that I was having that made me wish I was dead every month
Was endometriosis.
was actually the endometriosis causing appendicitis.
Yes.
So just imagine having appendicitis every month.
Listen. First of all, let us look at that for a second. Let us absorb that. Let the brain marinate on that for a minute. What I'm understanding about endometriosis, and even having these conversations, Shauna told us a story about how her respiratory system was having all sorts of issues because of endometriosis. And endometriosis is a whole body disease. We need to stop referring to endometriosis as a reproductive health disease, because it's as if it doesn't affect your womb and your ovaries, it doesn't count. And we have seen endometriosis cases where endometriosis is in the brain. The cells are in the lungs. The cells are in the pancreas, in the liver, in different parts of the body. And in your case, maybe we'll
know in 2 weeks.
In the appendix. And the truth is, if we know what is possible, then it gives us a broader lens to look at the thing, so that we can be more informed about what our options are.
Right.
And so that is so eye-opening. And I would really love to know what the results are, because that would help us to help some persons who probably having appendicitis every month and never realize.
Right.
Yeah.
Because it's chronic. It ends up being chronic appendicitis, right? So you feel it's a flare-up because obviously, like, as the endometrium is shedding, so is the tissue wherever it is.
Yes.
So if it's shedding in that, I could have just gotten rid of the appendix a long time ago, and just save myself all of this praying for death.
Of pain. Cut it out.
So I'm actually looking forward to my next period, because now I want to know what the experience is going to be.
Look at that. I want to hear about that. Interesting.
Yeah, so I am actually looking forward to it. Like, I'm over here saying, okay, like, let's see what's going to happen this time. Because, who would have known? And the reason he's convinced that it's endometriosis that was in it is because my appendix had scar tissue.
Oh.
Well, my appendix had to be peeled off of all my other organs, and it was fused with the bowel. But all of that was scar tissue. He said that he had to get through.
Well,
which would signify the endometriosis.
I have no doubt that he's right, but let us wait until the test comes.
So we'll wait on that. What else have I learned?
Advocate for yourself. Important.
Yes, that's the first thing. Because you can find things out sooner and not suffer for as long. So that's the first one. The second one is ginger tea. Oh my God. Oh my God.
I love some ginger tea.
And listen, okay, so I don't like tea with sugar. If you like sugar, that's your thing. I don't know how it affects everything, but I know that the ginger, I use an infuser actually. So I don't even put the whole ginger in. I just chop it up, put it in the infuser, and then put it in the hot water. And listen to me. Like morning, noon, and night, that is my beverage of choice. The warmth, like, kind of soothes.
Yes.
The ginger, they say it stops inflammation and whatever. Yes. In my case, obviously, the inflammation was too much, but it does help. It does help. So I really do like ginger tea.
Big up every ginger tea. When I make ginger tea, I don't have the fancy diffuser like you, because you just love gadgets and fandangles. I mince the ginger same way, but I put it in the water, but I chew on the little pieces of ginger.
No, so I know.
Because I like that. No. I like little pieces of ginger.
No, and I don't.
All right. Okay.
So, and then the other thing is, I love a hot pad, whether you use a hot water bottle or an electric hot pad.
Sort of heating pad.
Yeah, some sort of a heating pad, because that would help soothe as well. Because alongside the pills and stuff, everything doesn't work. Like, I had to do a whole cocktail of things. But the heating pad really would, at least calm the area.
Yes.
So that I could actually go to sleep.
Ease some of the tension. Like, yeah, man, for sure. A heating pad. I'm a fan of the heating pad as well. And the good thing about it is that nowadays you don't have to use the manual heating pad. You know, the original water bottle. You put the hot water in the water bottle. That still works if you still have one.
Yeah.
Take care of it. It's very, very useful. But there are also battery operated heating pads. Some of them are rechargeable. You can plug it in and you can use it. And so you have different gadgets and things that are available. So that's a good piece of advice. The heating pad is very good to help ease some of the tension in the middle of the discomfort.
Yeah. Right. So if you notice, all I can tell you the tips on is the pain part, because
that's been your story.
I know. Yeah. So I'm sorry I don't have something to say like, oh, do this stretch when I can barely get out of bed.
First of all, we are asking you about your tips based on your experience. I don't know what you're talking about. But I really want to know, you've told us what you've been through. What did you wish you knew? Now that you've gone through all of this, if you could rewind and come again, what piece of information, or maybe it's more than one, that you wish you knew from the beginning that you think would have definitely improved your outcomes?
What did I wish I knew from the beginning that would have improved my outcomes? I don't know. I don't know that I wish I knew anything. I feel like I wish there were, I just wish society was more female friendly.
Oh, okay. That's a good point.
That's the truth.
That's a good point.
Because I don't think me knowing anything, it wouldn't have changed anything.
Right.
I would just know.
Right.
So I'd know what to expect. I'd know, okay, this is going to happen. That is going to happen. I'd know to say, hey, every month, why is down here hurting? Maybe it's my appendix. I would, but that's still advocating for myself. And the truth of the matter is, you still need who to believe you.
Yes.
You still need the people to be kinder about your experience and your journey. And again, most of it is them believing you or not.
Correct.
And a lot of people just don't believe you if it is that they don't have that same experience.
I think you're exaggerating.
Yeah, because they don't have that experience.
Correct.
So they're judging based on themselves. Like, I can't tell you how many times I have to tell people, like, but we're all different. We're all individual. And this is in other walks of life, right? Like in other experiences, it's like, yeah, but that didn't affect you that way, but that affected her that way, or that affected him that way because of their experiences or because of them living in their own body. Like it's a different situation.
Yes.
So I find that we're just not as conscientious, empathetic, all the things that we can be for each other.
Correct.
And I if I had a wish, that would be my wish.
Yeah.
That we could just understand the experience of others better, or just try to make each other's experience better. Because even if we don't understand it, it doesn't hurt us to say, hey, you know what? If you're not feeling well, just don't come today.
Yeah, that's such an important point, because as you said, there's a lot of persons who, in their reason to dismiss how somebody else feels, goes, well, I don't, and finish the sentence, but I don't know anybody who, and finish the sentence. And it really isn't about you, and that is just the truth of the matter. When I bring up period leave to some people, they're like, I don't need period leave. Well, don't take none.
Yeah.
Just the existence of period leave don't mean that all of a sudden every woman is going to be missing from the office for 2 days every month. It just means for the ones who need it, they would have the option. So just saying that, oh, it's foolishness because you don't require it, doesn't mean that it is not necessary for the people who do. So that's such an important point.
Yeah, but just like sick leave.
Yeah.
Everybody doesn't take sick leave. You have the 10 days that are available to you. Whether if you're not sick, you don't use them. If you are sick, you use them. There.
Yes. So I really just think that is such an important point, because especially on the point of believing, just the fact that in expressing the fact that you're having this pain means that it might not be received by whoever you're expressing it to as something that is truthful. That's a problem,
Yeah, it is.
And so that just breeds a lot of people suffering in silence, not getting the help that they need, and just being in an environment where it's almost hostile for them. And so that sort of attitude is really, really negative. And I really hope that in this discussion, the persons who find themselves perpetuating that kind of behavior, stop. Because that's just what it's going to do. Just stop it. Just stop it.
Yeah. And in thinking about this and in talking about it, the one thing that comes across me is like, okay, so you're trying to say the person is lying about pain or being sick. But to what end? Like, how does that help your life? Like, even if you catch them in a lie, they're not really in pain. Like, what? So what? Like, in real life, how does it affect yours?
What's the prize? What did you win?
Yeah.
Nobody knows.
Yeah.
Yeah. You caught them. Okay. Now what?
Right.
Anyhow, thank you so much, Miss Gianna. We're going to take a break. We'll be right back.
Is brought to you by Herflow Foundation. The Herflow Foundation is dedicated to improving menstrual health and addressing key social issues affecting women and girls in Jamaica. Through advocacy, education, and direct support, Herflow works to break the stigma surrounding menstruation and empower women to live healthier, more fulfilling lives. Herflow's flagship project is to end the period poverty in Jamaica. Since inception, Herflow has donated over 9 million menstrual products to Jamaicans in need. To learn more about Herflow, please visit embraceherflow.com.
Oh, it's been such a wonderful conversation with my guest, Miss Gianna Fakhourie. And of course, it's time for Ask the Period Lady. Usually you ask us a question, but like how we have our guest, she gets to ask me, the period lady, a question. What's your question for the period lady?
So I have this question from I heard her talking, and I didn't want to interrupt and sound dunce, right?
Okay.
And I'm sure you guys know the answer at home because you watch her all the time. You know the period lady. But some of us newbies, like I've watched her, but I don't know everything. But some of us newbies need to find out.
Mm-hmm.
You were talking about your luteal phase?
Yes.
When is that?
Oh, that's a good question. All right. So let me give you the whole thing. So the menstrual cycle goes through 4 phases, right? The first phase is when you actually have your period. Sometimes about 5 to 7 days, depending on the person. So during that phase, that's when your uterine sheds, that's when your period comes out, all the things, right?
Oh, the egg drop.
Listen, that egg drop is a soup and them sell a restaurant. The pasta food is more egg drop, right? So, and then after the luteal phase comes the follicular phase.
Hold on. So luteal is when you're having your period?
No. I misspoke. Period phase, then the follicular phase, right? In the follicular phase, and how you would feel. Let me tell you how you feel. So in the period phase, people feel differently in the period phase. Some people don't have as much energy as they would have. Some people can get along just fine. The period is flowing and they're going up and about, going about their business the same way. Some people during the period phase are very, very aroused. That's the thing.
I've heard about that.
That's the real thing. Their bodies stand up on them and they want all kind of stimulation and things. If you're into that, get yourself a vibrating friend and go to town. All I'm saying is, or if you have a partner who wants to help you with that problem, then go right ahead, put a towel down. It might be a little messy, right? So that is the period phase. Now, then we move on to the follicular phase. Now, in the follicular phase, that is when the lining is shed in the period phase. So now your womb is brand new and she has lots of estrogen flowing in her and she's ready to get the cycle going again. So she's going to be making house and things. So in this phase, you're full of energy. You have lots of creative ideas. If you want to go to the gym, this is a good time to start. If you have a lot of work to do, you can do it now because your brain is going to be braining. You're going to feel like you want to be up and about. I don't know those people get up in the middle of the night and start clean. Follicular phase, right? You have some whole heap of energy. For those of you who have a partner and your body feels sexy, you want to do the things, jump them bones. So that's the whole thing. In the follicular phase, you have a lot of energy because right after the follicular phase comes ovulation. And you remember I tell you about your body jumping up and down? During ovulation, it makes you make some questionable decisions because you might call back the ex, the person where stalk your phone, you might say, all right, give them a chance. Don't make any permanent decisions in your ovulation phase. You might regret it after your senses come back. My point is, the ovulation phase is when the egg drop. It's when the ovary releases the egg, and then the egg starts her journey to the womb, which the womb is already getting herself ready because now she's going to be preparing for this baby because that's all our body does, prepare for babies, right? So During the ovulation phase, your energy's still up, you're feeling sexy, you all of a sudden, the man you never liked so much, him start look cute and so, and the things we must say start make sense. But like I said, that's the ovulation, because what is he saying is go, get pregnant, get pregnant, get pregnant. That's what is going on in the ovulation phase. And just make sure say anything where you do it carefully if you're not interested in having babies. If you want to have babies, I got a thing, right? But that's what goes on in the ovulation phase. And then right after ovulation phase now is your luteal phase.
Okay.
In the luteal phase is when the lining really gets thick, the line of the womb really gets thick, your estrogen levels drop, your progesterone levels go up, and so all of that energy that you've been enjoying starts to go down. You don't feel up and about anymore. You just want to lie down somewhere and eat food. This is where you start crave all kind of things. All of a sudden you want cheese and salty and crispy things and chocolate and all of the things because your body trying to getting some more calories and things. And there are lots of different foods that you can eat in the different phases that will help the phase. In some phases you're going to need more vitamin C, more vitamin D. In some phases you're going to need more magnesium and zinc and all these kind of things. I need to do an episode on that. But during these phases can be very, very up and down for some women. Some women are 4 different people during each phase because it goes through all of that. But the truth is, if you understand your phases, then it will help you be more efficient because you can reserve certain activities for when you're in a follicular phase. So you don't have to do it in your luteal phase. Some of you're studying and things. You want to make sure that you try to do as much work as you can in your follicular phase because when you get to your luteal phase, you're not going to feel as sharp. So that is what the different phases are. And your body go through it every single month. That's why sometimes you just feel like a different person.
Wow. Yeah, because I'm listening to you talk and I'm like, wow, like, so we're battling like every month.
Yes.
All the time.
Yes. Correct. And you know what? Men wake up in the morning, they have the same hormone level, and they go to sleep, and they do it again. And they don't have to worry about 4 different personalities and all these things, which is why, gentlemen, it's important for you to know the different phases, understand the woman who you're with, understand her menstrual cycle, because it will be a very useful tool for you in your support of her, and also know when to pick which fight for your own safety. Just saying. All right? So that's Ask the Period Lady. Thank you, Gianna, for your interesting question.
Oh, well, thank you for talking so much and making me say, oh, wait, what is that?
All right.
Yeah.
All right. Well, thank you so much. Don't move.
Everyday Period fam. If you're loving these real unfiltered conversations about reproductive health, don't forget to hit the subscribe button and turn on notifications so you never miss an episode. Join the movement by liking, sharing, or dropping your thoughts in the comments. We want to hear from you. Let's keep breaking the stigma and spreading the knowledge. Periods don't stop, and neither do we. Follow us on Instagram, TikTok, LinkedIn, and Facebook at Herflow Foundation.
Thank you so much for joining us on this show, and thank you to our big, fabulous guest, Miss Gianna Fakhourie, for joining us and sharing her period story with us. And before I leave, I just want to remind you that reproductive health is not just about period and pregnancy. It's about how you take care of yourself every single day, mentally, physically, socially, even spiritually. Everything that you go through from puberty to menopause is a part of your journey. So be kind to yourself and each other as you go along the rest of your day. I want to say thank you for joining us, and I'll see you next week. It's the Period Lady. Thank you so much for joining me. Take care. Walk good.
To get in touch after the show, send your questions or comments to embraceherflow@gmail.com. Until next time, remember to like, share, and subscribe to our channel, Period TV. Follow us on Instagram, TikTok, LinkedIn, and Facebook at Herflow Foundation. Our website is embraceherflow.com, and don't forget to subscribe to our newsletter. Thanks to our production team, April and Digital Pro, for the great support, and thank you for tuning in. See you next time. Take care. Walk good.